I'm Miranda. You guys know me. Today I'm going to be talking to you about neuromuscular transmitter junction blocking agents. It's a lot of words, just bear with me. This is actually a topic that we went over in class last week with Mrs. Morelli. So I'm just going to break it down for you a little bit more simpler and give you an easy way to remember it. So the first thing to note when talking about NMJs, neuromuscular junction transmitters, is that it's going to be working with your muscle fiber. So in this drawing, I have drawn a muscle fiber and where your neuromuscular junction is. When talking about neuromuscular junction, it's important to note that acetylcholine is the main neurotransmitter that is working with your drug. So it's either working with your drug or against your drug. And this is where this is going to happen. So it's going to be actually right on top of your muscle fiber. Like I said, the acetylcholine is the main neurotransmitter that's working with your parasympathetic nervous system. So within NMJs, you have non-depolarizing and depolarizing. Now, there's one main big difference between the two, and that is depolarizing only has one drug under that class, and that's going to be succinylcholine. With depolarizing NMJs, they're going to have a very rapid onset, but they're going to last for a very short time. So when you're given this drug, your recovery is going to be a lot faster. It's going to happen a lot faster, and they're going to recover a lot faster. It is not recommended to be used on young children, but they do use them in C-sections. So when doing a C-section, it's important that the patient is being monitored because it can be transferred to the patient or to the fetus. With non-depolarizing, there are 5 drugs under this category. Now these are going to last a lot longer. So those are the big main differences. Within the two, it's very important that you go over with your patient their family history. So do they have a history of a malignant hyperthermia? Do they have cardiovascular issues? Do they have respiratory issues? Those kind of things. This is kind of a sedative drug. It's not used for sedation, but it is used with sedation. So it's very important that you're also asking your patients if they're taking any herbs or supplements. So we know melatonin is a very common herb that people take to help them sleep, along with kava and valerian. Those are 2 herbs that people like to take to kind of help induce sleep or sedation. Another big thing to note is that with depolarizing NMJs, you want to be careful when you're administering this with somebody who may have a fractured bone. The contraction of the muscle can actually cause further trauma to the injury that they already have. They both have the same adverse effects. So like I said, reviewing your patient's history and family history is very important. Another thing to note is that complete recovery from these drugs is going to take 2 to 3 hours depending on the patient. When you are administering this drug, you need to make sure that you have a nurse anesthetist with you or a anesthesiologist. Like I said, this is used with sedation, and it does put stress on the respiratory system as the muscles are being relaxed. Another thing to monitor once your patient has been given this medication is while they are recovering, you need to be very vigilant about their airways and respirations. Like I said, it is relaxing your muscles, and you want to make sure that they are improving and they are getting better from the drug and kind of coming out of it and able to breathe on their own. You also want to make sure that they're not getting any bed sores and things of that nature if they are going to be on this medication for a long time. These drugs are metabolized in the liver and they are excreted in your urine. So let's move over here to how to memorize NMJs or neuromuscular junction blocking agents. So the most important thing to know about this drug is it's either working with or against acetylcholine. So we know that an agonist is 4. So agonists are working with acetylcholine, and we know that antagonists are working against acetylcholine. And so I have it in order as acetylcholine depolarizing 4. So depolarizing is 4 acetylcholine, and non-depolarizing is against acetylcholine. So the way to remember this is astronauts described funny nurses aggressively. And that is a way for you to remember your neuromuscular junction blocking agent drugs.